are. Know why polydipsia occurs, know why polyuria occurs. Deja occurs, polyphagia. Who has to be involved for diabetic mellitus control? So yeah, it's not only just the patient, it's also family, and also other healthcare providers, right? Cassie? So we talked a little bit about diabetic neuropathy. You know what that is? How a patient might have clinical manifestations of it. So sometimes, this is one topic I think you probably already know, but real quickly, we always do the non-invasive and the non-costly one, right, first. Same thing with medications. We're going to do the ones, we're going to try to get them controlled with the exercise and the diet before we even start the medication, right? Give them a few months to see if they can actually get into a routine of exercise and eating healthy, to see if that works. If that's not going to work, or if the healthcare provider can tell that this patient, is not going to change these important things, they're just going to start the medication, right? But just like in blood pressure, if the blood pressure, they start with one pill, and the blood pressure is not getting controlled with that one pill, they'll either do one of two things. They'll increase the dose, or they'll change the medication to something else, or they'll add a medication. And as the hypertension, same thing with diabetes, as the disease process is not getting better, you will see it's not controlled. You will see that these patients are on 3 or 4 different blood pressure medications, right? They're trying to control their blood pressure by different means, right? One might be an ACE inhibitor, one might be a beta blocker, right? Different mechanisms. Same thing with diabetes. They'll try with one pill. If the one pill doesn't control it, well, okay, we were trying to work it with the liver, but that's not really working. So let's start another medication that works with the beta cells, the activation and release. Okay, so that's the same thing that they will do in healthcare. So if your patient asks, how come you'll want to have a good idea of why a patient, be prepared to share with your patient and the question, an appropriate response for someone who's taking more than one diabetic medication. Sometimes people when they're hospitalized, they go on sliding scales even though they don't have diabetes. And that is because research has showed that they have better outcomes with whatever illness or pathology they have if their glucose is well controlled. Make sense? Mm-hmm. And sometimes the medications that we give, such as people who are having an exacerbation of COPD or asthma, like we talked about before, those medications that help control and get them to actually breathing, which is really important, breathing good, might tax another system, like the endocrine system, for a while by increasing the glucose levels. So then we're treating that cause that we created, their hyperglycemia. Doesn't mean that they're going to now turn into a diabetic, but they do need that additional help, right, while we're giving them a steroid, which is going to increase their glucose. We talked about the importance of potassium with DKA and the ectopy, or the arrhythmias, the changes that we can see on the EKG. So keep that in mind whenever you see that someone, when you look at some labs that look like they might be in DKA, one of your highest priorities will be not only fluids, get the fluids going, but also get them on a monitor so we can monitor those changes as someone who has a slow healing wound, what kind of teaching are you gonna emphasize with him? What kind of questions are you gonna ask about his health history?
Nutrition?
Yeah, and what else? What kind of, why does lactic acid increase? We haven't talked about that one, but I want you to know, why does lactic acid increase in the body?
Muscle.
Why does,
Carbon dioxide.
why do ketones show up in the body? In a DKA situation. Let me rephrase that. In a DKA situation, why do lactic acid occur and show up?
Oh, it's the
And why do ketones show up? I'm just gonna continue on. I don't mean to be rude, it's just 2:00.
Did you say fat breakdown?
Where does the body try to rob energy from? When the glucose is not getting utilized?
fat.
Fat and?
Muscles.
Muscle. Okay.
Fat and muscles.
When someone only has impaired fasting glucose, just impaired, if not, completely destroyed, why does lifestyle change, why is that important?
Because in the pre-diabetic phase, and if you want to prevent them from acquiring diabetes completely, exercise and nutrition are the best ways to keep them.
Why is exercise important for someone who has diabetes?
To regulate glucose levels.
To what?
Regulate glucose levels. Regulate glucose levels.
Also, remember, we're trying to avoid metabolic syndrome. Also, right?
What?
Also,
Metabolic serum
We're trying
something.
to avoid metabolic syndrome.
Oh, metabolic syndrome.
All the benefits of
Avoiding.
exercise and all of that.
Sorry, guys.
At the hospital and probably at the nursing home, we always are wiping people's fingers with alcohol swabs, right? But that's not necessary, you know that, right? As long as their hands are clean. So soapy water would be appropriate for someone who has really dry, brittle skin or, poor skin. A little bit of hand cleanser or soap and water might do better than the drying of the alcohol. But a clean puncture site is very, very important, especially with an individual with diabetes. We talked about people being sick and what kind of nursing interventions you're going to teach them to do, or education, right? Increase the frequency. Call their doctor. So if we're making their glucose levels get increased by sending them home on a steroid or have diabetes, we're going to encourage them to check their glucose more frequently, right? Because they're at a higher risk of having hyperglycemia. And then they should do what? Call their doctor and let them know what the trends are. That, you know what, my blood sugar is 50 points higher, but you've got me on this regimen where I'm only supposed to take 10 units of